So let's have a look at it from that patient's perspective. And this is essential, this is powerful, and I know we sometimes forget about this. Um, but understanding it from the patient's perspective when they come to the emergency department can bring that empathy and clarity back into the situation and back into the way medical care is delivered. Now, please, I'm not saying anything is done incorrectly. This is just another perspective on patients. Let's take a look at it from what patients have said, because it is a patient on the other side of the door, on the other side of the curtain, in the bed. I feel ashamed to be here, like I have to justify my pain to every person that I see. Patients know, patients know that emergency staff roll their eyes at them. They call them frequent flyers, drug seekers, even when there is severe distress, even when they feel judged, even when they feel dismissed, even when they are disbelieved. So that's one. Number two, this isn't a decision I make lightly. So because the patient is knocking on your door doesn't mean they just dropped everything and come straight to see you. They think about this. They don't want to go to the emergency department. It is a last resort for them. It's not a habit. It might follow days or hours of unbearable, severe pain. They might have failed self-management, and they might be unable to access GPs and pain clinics, of course. Medications are not working. Medications are even harming them to a point. Number three, I'm not looking for opioids. I'm looking for relief, and I need to be treated like a human being. So patients have tried the strategies that they've had in place: heat packs, pacing, nerve blocks, CBT, mindfulness, medications, all these tools that they get given at pain clinics or from GPs or physios and other allied health practitioners. They're coming to emergency department for reassurance, relief. Sometimes they're coming just to feel safe. Sometimes they're coming just for that reassurance. They're not necessarily coming for a fix or a drug. Number four, I hate being here, but my pain is real. And that's terrible to think. The patients know that they've been told that their pain is not real, or that their pain is in their head. They don't want to be there. They hate being there, but they've got nowhere to turn. Remember, the emergency department, while it's your comfort zone, it's your office environment, it's bright, it's noisy, there are long waits, there are so many other distractions and intrusions, which of course can worsen symptoms in some instances. So when pain becomes unbearable, when patients attend, they hope that they are going to be assessed without judgment, without bias. Number five, I know I don't fit the usual emergency model, but I still need help. Patients are aware that they don't fit in with the acute emergency department model. They understand that this is not an emergency, that this is not an acute problem. They don't want to block beds. They don't want to intrude. They just want help. And clearly, as we go through the course and module, we'll put together a way of addressing this. Every bad experience makes me wait a little longer the next time, even when I shouldn't. Past experiences being dismissed create problems for patients. Sometimes patients delay seeking care when they need to seek care. So the boy who cried wolf, of course, patients with chronic pain do get acute problems. In our clinic, we have had patients with chronic pain that we've diagnosed with multiple sclerosis, diagnosed with metastatic abdominal disease, diagnosed with tongue cancers. These are just a few off the top of my head. So patients with chronic pain patients with chronic pain get medical conditions. And that's the difficulty, to tease this all out in a short space of time. Number seven, I would love not to attend the ED, but the system gives me no other options. I've got nowhere to turn. There are lack of services out there. And in a crisis, patients attend an emergency department, or in a flare, patients attend an emergency department. So this is the patient's perspective.